Okay, go ahead.
Good morning, everybody. This is Bernadine Jocelyn here today with Kristian Bracken from Region 9. And my team, Mary Magnuson and Ann Tracy, we're here to listen in and visit with Kristian about the work that they've been doing in Region 9 on telehealth, including in particular the work that Blandin Foundation was privileged to support in your region. And so, Kristian, could you just start out by kind of giving us an overview of the project? And of course, we're interested in hearing about what you're learning as you go.
Very good, Bernadine. The idea came out of our legislative priorities. We have two legislative priorities that directly are tied to the type of services that we approach Blandin about, and that would be substance abuse prevention and mental health. And following conversations with the Blandin Foundation, we realized that telemental health, which of course is very dependent on the broadband coverage throughout Region 9, is an effective way of reaching populations that are underserved when it comes to mental health services. And this also fits very well with our priorities to engage community members that are not near areas where we have a lot of mental health services available, which are critical for workforce development and making sure we have a healthy workforce. So we were very fortunate to get funding from the Blandin Foundation to develop a telemental health portal in Region 9. And we had ongoing conversations with direct counseling and assessments in the Twin Cities. They had already developed a HIPAA-approved portal for delivering services and were licensed throughout the state of Minnesota and the upper Midwest to provide those type of services at a sliding scale. And we basically developed an infrastructure where direct assessments were able to connect with school districts, with city officials, with county representatives, and even probation officers that could make referrals to the services that they could deliver. And we marketed it through our newsletters, through our website, through our social media. And I'm very happy to say that it was so successful that within a month of being up and running, the portal was functioning to capacity. In fact, we had to have a conversation with direct counseling and assessments about potentially them bringing on other counselors and to be able to fill those needs. They also did quite a bit of research as part of trying to understand our region, being metro-centered for most of their services. So they examined the geographic needs, and what they found was eye-opening in terms of the needs that existed for mental health services throughout our 9 counties. The further away we got from the Mankato MSA, the fewer options folks had, and what they learned was that in many cases, people would either not access mental health services, or they would drive 2 to 3 hours to get assistance. They also found that the waiting lists were extremely long, and that many groups were unable to access these services because of those transportation costs that were involved of meeting with providers.
Excuse me, Kristian, a quick question. You said distance from Mankato MSA, what's that?
Metropolitan Statistical Area. So we only have one metropolitan statistical area in Region 9, and that would be the Mankato North Mankato MSA.
Okay.
Yeah.
So is that how you guys locally refer to like the Mankato area? Is that like instead of Greater Mankato, it's Mankato MSA?
I typically do it because I do distinguish between the only MSA and the non-MSA areas. But no, most people will call it Greater Mankato.
Okay.
Yeah.
It's a researcher census type term.
Exactly.
I could see Ann smiling at me there, like, don't you know that, girlfriend?
And you know what's interesting is if you have an MSA, there's all sorts of data being collected. Like Anne says, it's very census driven. So in terms of finding socioeconomic and demographic data that exists at MSA level, once you venture out in rural areas, it's very difficult to get a lot of detailed demographic and socioeconomic data. So yes, and from like a research standpoint, there's so much we don't know about the non-MSAs, and for our region, that's the great majority. So
I interrupted you. Please continue.
Oh, can I say something real quick?
Yeah.
Can I just point out for anyone that might be watching this later, this grant was made in October, it looks like in October of 2019. So pretty timely.
Yeah.
Yeah, the grant period ran through May of this year. So we captured COVID, or the early onset of COVID, and that's really when we saw the big spike in demand. Other areas that were discovered during this work is there's a lot of focus in the state of Minnesota on opioids, but in our area, alcohol definitely showed up as the drug that really needed a lot of referrals, both from the legal system, but also from concerned employers, concerned parents. So we did see an increase in need of assessments. Rule 25, so the court-ordered assessments for alcohol use, and it really was one of those areas where folks in more rural areas really had very few options if they did not do assessments via teleportals. And the other thing that of course happened was COVID, and concerns that folks experienced as layoffs took place, plants closed down. Our region is heavy on manufacturing. It's the largest sector for employment, and many of our food manufacturing plants closed, at least temporarily. So folks did experience a lot of uncertainty and strain during this time that the grant period took place.
So Kristian, where is the project today in terms of the partners' roles and your role?
We are continuing the work with direct assessments, and we have talked about potentially doing county-wide spaces to make them available for folks who do not have appropriate broadband support, that they can go somewhere in the county and have a private place to access a computer. We're talking to some individual communities. Right now we're talking to the city of Amboy, which is in Blue Earth County. We're working with them on potentially setting aside a space down there where people from 3 of their communities, Amboy, Good Thunder, and Vernon Center, will have a space where people can access both telemental health and other health services. What we have found through this work with direct assessments was that many folks do not have the technology. Many folks don't have sufficient broadband speed to access the services. Many folks do not feel comfortable accessing these services either from work or from home. So that neutral space might be very important to develop. So those are things we are exploring. We are also working on potentially writing in telemental health services into a service offering that we are hoping to implement as part of a virtual resource center for our region that we are working with the federal EDA to secure some funding for, which is meant to boost the workforce that we currently have. One of the comments we get frequently from the federal EDA is saying, you are talking about labor shortages in your region, but until you have a higher workforce participation rate, we don't really want to fund projects. So we are more interested in skilling and strengthening the workforce you already have and making everyone able to participate in the workforce. And we recognize that mental health services is a critical step in getting people to gain career skills and experiences that can further their economic stability or resiliency. So this was a crucial first step for Region 9 to get involved, but the work is by no means ended. We also hope to partner with organizations that have the cultural awareness and understanding to work with more diverse groups. And that's something we are leaning a little bit on our regional partners. We're leaning on the relationships we have with Blandon and some of their efforts as it pertains to diversity, equity, and inclusion, and direct assessments and counseling up in the cities are also making connections with some of the groups in the Twin Cities that have networks to particular immigrant groups, so we can reach a more diverse audience. The direct assessments are also talking to some of the veterans groups in the region in terms of promoting the services that exist. Many of our regional veterans are driving to the VA for counseling services, and of course that's very in the Twin Cities, and that's of course challenging when for folks with young families or work during the daytime or just the logistics of getting to the Twin Cities. So those are also areas we continue to explore. My guess though is that we will need additional partners that can provide these services. Direct assessments are pretty much at capacity as is.
Kristian, are they like a consortium of health providers then? Are they a business, a for-profit business?
They are a for-profit, and but they are working very closely with other providers to offer.
So they like bring providers into their network, right? Who then can participate with you service delivery partners.
Correct.
Yeah. That third space model of a place where people can access telehealth, mental health, not at home or not at work is kind of the core of this approach.
Correct.
What kind of spaces are you finding in your communities to be used for those?
That is the question that I think will be critical as we move forward. The best example I can give is in the city of Amboy, population 600. Their local Amboy area community club, which is kind of the de facto chamber. We're working with them now on the acquisition of a 100-year-old bank building that they envision as the future library. It's been housed in their city offices, but the city needs the space for public works. So there's an opportunity to purchase this old building, and they're working with the Blue Earth County library system to have a branch in Amboy, and one of the kind of prerequisites that they have for making it a community space is that there will be city services there, but there will also be a private space that people can utilize for accessing healthcare services, and that will be written in as part of a feasibility study that we're doing for them right now. So that's like the best space I can think of in terms of where there's community engagement, and there's ideas about how this type of space can be repurposed for serving the communities. In that case, it's not just the residents of Amboy, it's also the cities of Vernon Center and Good Thunder. We have also had direct assessments talk to folks in Faribault and Markham County, and that would be about the potential of having space. But those conversations are going to be at the county level, and that would probably be in more of a building that belongs to the county. But that is really the challenge, is finding that space that, so I do really like the model they're thinking of in Amboy, where they're trying to find a kind of a safe space, because it could be other services that could be delivered, like consultations with legal advisors, or, you know, where the privacy is important. It's also interesting in terms of both substance abuse and, I think, with mental health services. We have always assumed that people are comfortable accessing these services from home, but in some cases, I think what we've found through this work is that the home is not always a safe space. So that's why we are thinking of being able to provide that space. People can certainly access these services via their phones. It doesn't necessarily have to be via the computer. The app is available on the phone, so that's, as long as there's a camera and they can transmit the sound, they're fine. But it's being able to create that safe space for people, and that's why we like the idea of having these type of spaces in a multi-use space where people could come in from a variety of reasons, and it's not that stigma of, I'm going into the mental health room, you know, or the mental health building.
Yeah. The green room.
Exactly.
So as you look across the region, and you're looking for partners that want to work with you to develop this asset or whatever in their community, who are you working with? Who do you reach out to? What are your local partners look like?
You know, that was great. A great question. We started with our commissioners. So we have a commissioner for human health, and she was extremely helpful for us to reach county officials and local groups that make referrals. She also got us talking to some of the school districts. And of course, COVID happened in the middle of this, so it kind of stopped the progress we were hoping to make with the school districts, but at least it was a door opener. So we started with our commissioners. We have also talked to folks at the higher ed institutions, at South Central College. We talked to people in their ag program. The ag program at South Central had connections with farmers. They also have connections with a program that transitions former military personnel to farming. So that was a very good referral, and we got direct assessments to be part of a consortium up there at South Central College. We have also talked to people in social work at Minnesota State University, Mankato, and they had ideas and referrals that were fruitful in terms of getting to talk to people. They also reached out, direct assessments also reached out to, in the Mankato MSA, they reached out to Nicollet County and Blue Earth County probation, and had connections with them. So they were very proactive, so they made the job relatively easy for us. We also did a little bit of social media coverage and through Region 9. And we had direct assessments promoted to our board, so the board members could take it back to their communities. Our board has representation from all 9 counties. So it was a little bit word of mouth, and then being strategic about who do we think could reach the most folks in each county.
Mm-hmm. Nice. Well, I imagine that insurance has been a trick, right? Were there exceptions made during COVID to allow reimbursement for telemedicine that are temporary, or are those going to be made permanent now? Do you have any knowledge of that?
You know, the only thing I know, and I'm definitely no expert on this, but I can certainly reach out to Amy at Direct Assessments, who's our contact person, and ask her. But I know there was an expected change that was going to take place this year, where the counties would decentralize the referral system to the local communities. And then there came a mandate back from the state saying that's not going to take place this year. It has been postponed 2 years. And it made it a little more difficult for them to get referrals from the counties, because basically that would mean that the provider would have to have a insurance plan that ran through each county. And instead of basically saying that the local provider could say, I'm making a referral to direct assessments, you can go there. So that was the only kind of hiccup I know took place that we were hoping would be, and I can get you more information about that. Amy can speak a lot more specifically about that, but that was one of those things that were anticipated this year, that there would be a little bit more local access, where a local provider could say, we refer you to someone who can do telemedicine or telehealth, telemental health. And that didn't take place. And I think it caught a lot of the medical health providers off guard. But I'm not sure why, but I'd certainly be happy to reach out to Amy and ask her specifics about that.
Well, I was just curious. Ann and I follow. Ann is also, among her many duties, also sits in on all of the broadband task force meetings. And for years, broadband task force has had its eye on the barriers for reimbursement to telemedicine provisioning. And it was just I was just curious. I don't need to hear more from Amy, but it was my impression that there had been some liberalizations or accommodations made already in place, but with COVID, there was kind of like a blanket, telemedicine is now okay, but I got the impression it was a temporary thing that needed to be either made permanent or revisited. But without that reimbursement, right, none of this could work, correct? That's a key pillar of this goal.
Absolutely.
Yeah.
So,
well, if there are any, I guess one thing you could tell Amy is that if there still are barriers that she or others are experiencing from a policy perspective on reimbursement, to let me know, because we would have an opportunity in the broadband task force report to speak to that. I know in the past we have. So just, let me know if there is work to be done at the state level.
Yep. I will get the specifics from Amy, and she's really good at writing things up. So I will connect you. And what I said might be completely wrong, but
Sure.
I know there were anticipated changes that would make those kind of reimbursements easier, and also with respect to the referrals, and they were, like Amy said, they were very caught off guard when those changes were delayed. So
yeah. Well, it's interesting to hear that it's usable on your mobile device too. And I would think for certain populations, for the young people and so forth, that might be better. Yeah.
Oh, absolutely.
I'm wondering if Ann or Mary have any questions you guys want to ask to Kristian. I don't mean to dominate like this.
No, I guess some of it is how are the folks who are the recipients of the services, how are they feeling about moving on to technology?
That's a great question, and I do think the challenge with assessing the benefits or the outcomes is, of course, the privacy. We don't know who direct assessments clients are, but we did ask direct assessments to kind of document the feedback they received. They do a lot of documentation in terms of with their existing clients, particularly in the Twin Cities, where this has been a common method of providing services for a longer time. And kind of like the indirect feedback we received from direct assessments was that there were only positives. No, there were many folks who felt it was a very comfortable way of sharing their experiences or accessing services. So we didn't hear anything negative That said, we don't, of course, know feedback from those who did not access the services, or maybe access services and were never heard from again. You know, so we are a little bit limited in terms of knowing really how people perceived it. But I do think the big benefit was really those people who were mandated to access services that had maybe a court appointed request to access services, whether it's for therapy or assessments. And just the fact that they did not have to drive to either Mankato or the Twin Cities necessarily to meet with someone who were licensed to provide those services. So that we did here was viewed as a huge benefit. That said, at times I think when I talk to Amy about the work, it's at times you get overwhelmed and you realize this is a drop in the ocean. You know, this mental health and substance abuse is such a pressing issue. And with COVID, the demand seemed to spike so dramatically that I think it's important to remind ourselves that this is a great first step, but that this should be a huge priority, not just from a community development standpoint, but this is truly an economic development standpoint. We need to strengthen our workforce. We need to give families or workers opportunities to access services regardless of where they live. And we are forever grateful to Blandon for taking the chance on doing that. And although we can't reach everyone, and Direct Assessment is not a huge organization, I do think this was a very critical first step. And it was very interesting when we presented this to our board, and we actually did kind of a mock session with them where we called in and you know, they got to see how easy this works and had that conversation. It was interesting because sometimes it's difficult for us to engage commissioners in the work we do because they don't deal with it on a day-to-day basis. But this was one of those subject matters where the discussion went much longer than we had anticipated, because I think everyone knows someone who struggles with mental health or substance abuse. And I think anyone who lives in a rural area know that services are difficult to access. So it was very encouraging to see how much our commissioners and board members cared about this particular program.
Neat. Well, of course, it's a privilege for us to support this work, but the real accolades go to you, Kristian, and your team for having the vision to see a role for Region 9 in this. And I'm wondering if you have any words of advice to peers of yours across the state. Is this something you think is appropriate role? I mean, obviously you do, but why do you think it's important for economic development commissions like yours to play this role in your region?
It's a great question. I think, and I could probably talk about it for an hour, but I think for me as a person who works in economic development, I do think we very often think only about economic growth and prosperity. But I think it's important to remember that the strength of a community starts with the individuals that live in that community, and that we can't function as organizations, as communities, as firms, if we don't have a healthy workforce. And mental health is definitely a critical issue for us. And I do think each regional development organization really needs to start thinking about economic development as something that hinges upon having adequate services to make people prosper as human beings, and that it starts with a healthy mind, healthy body, and that health is as the foundation for being economically prosperous. So I don't know if it's changed my mind, but it's definitely this work has really reconfirmed how important it is that everyone is provided an opportunity to contribute to their abilities.
Well, you must have, thank you for that, but you must have looked around and said, well, there's nobody else in the region doing this, and if we don't, who would? Something like that, right? I mean, that you saw yourself at the commission. Just, what you did was imagine a whole new set of relationships, partners, and opportunities, and you saw your role to step in there and make that happen.
Sure. Yeah. You know, I think that's the role that our commission can serve, is to take all the great assets that already exist, and if we can lower the barriers for folks to access those services, we have a lot of resources locally. We have a lot of resources through our networks, and I think that's kind of for us as a development commission, I think that's really the future of our work is we don't have to develop new programs. What we really should be doing is bringing together the resources that already exist and try to lower the barriers that we have created by not communicating to folks where those services exist and how we can access them. So that's what we're trying to do through some of the work we're doing with the Resource Center that we are talking to the EDA about, is there's a lot of available resources, funding from the state, funding from the federal government, from foundations, to get people to develop their or further their careers or access job skills. But very often people are not aware of it, and we're working side by side instead of working together. So that was sort of the motivation for doing this, and
I bet that COVID, that idea will have real legs now, you know, in the new COVID reality that we're all living into. So that's excellent.
Absolutely.
We'll have to schedule a conversation with Anne again to hear more about that idea when it gets farther down the pike.
Yeah.
Oh, absolutely.
Well, I think with that, I don't want to take any more of your time today. I really appreciate your taking the time, Kristian, to talk to us more about this effort, and congratulations. You're making a real important difference in Region 9.
I appreciate that, and I appreciate the opportunity to share the work we did. It was we're very, very grateful to Blaine Foundation for your continued support, and to all our partners. I feel like we were just the facilitator, and everyone else chipped in and assisted us. So it was really a team effort.
Teamwork, yes,
Yep.
indeed. Good. Anne or Mary, do you have any final questions or comments before we let Kristian go?
Not me. Super interesting. Thank you so much for your time today.
No, absolutely. Thank you both. Nice meeting you both. Bernadine, always a pleasure. Yeah.
Really a pleasure.
Thank
Give
you
my
for your
love
work.
to your team.
Yeah.
Thanks for all you do.
Thanks. Hope to talk soon.